Peter Gies is from the Joint United Nations Programme on HIV and AIDS, known as UNAIDS. He joins us now live from Geneva. Peter, where are we in the fight against HIV and AIDS? I know now that thanks to medical treatment, people can live long and healthy lives despite a positive diagnosis. But is the rate of infection falling?
Right. So we actually are building on a very positive trajectory in the recent years. We've recently announced that more than 15 million people, in fact 15.8 million people, are now receiving life-saving treatment. In addition to that, we have observed since the year 2000 a 35% reduction in the occurrence of new infections, and also in large part due to the availability of the treatment. The mortality or people dying because of AIDS has also been reduced very dramatically by about 42% since the year 2004, when mortality rates were highest.
What are the prospects, though, for ending the epidemic by the year 2030? Part of the Sustainable Development Goals, of course. You've got a very short window of opportunity to be able to do that. Can it be done?
Right, so we definitely think that it can be done, and in saying so, we are building on the successes of the recent past, and we are also taking into account the fact that the currently available tools, that they are sufficiently effective, so that if we bring all of those tools together and we apply them in all the countries that need them, then we think that yes, it is possible to end the AIDS epidemic by the year 2030.
I suppose,
as you indicate, it will actually require a more intense effort over the next 5 years. We think that there is a short window of opportunity of about 5 years to the year 2020, where indeed everything that we have needs to be applied more intensively. We need to reach higher coverage of treatment. We need to reach more coverage of our different prevention programs, and that we think will allow us to end the AIDS epidemic by the year 2030.
Thinking, Peter, back to our report of a few moments ago, how do you end the stigma that surrounds HIV infection still in many parts of the world and in many societies?
Right, so stigma and discrimination have always surrounded the AIDS response. And so the response needs to, of course, address those elements that can be addressed directly by biomedical interventions such as treatment or such as condom use or circumcisions, as happens in parts of southern and eastern Africa. But of course, in all programs, whether it's in Africa or elsewhere, the stigma and the discrimination needs to be addressed. And there is interesting developments that happen recently. So several countries recently have tried to assess what the levels of stigma is in their healthcare workers, and on the basis of that are instituting programs to reduce that stigma.
Peter, many thanks indeed. Peter Gies there.